Honestly, we are seeing the whole breadth of GI conditions. We're pretty much seeing everything. And some of it is what Sam alluded to. Sometimes we're seeing patients where we're the first provider, like medical provider they have seen ever in their lives. So we are also making a lot of new diagnoses. But yeah, we're seeing the whole spectrum. A large majority of what we see is what now is called disorder of the gut brain axis, functional GI disorders. So a lot of chronic abdominal pain, reflux, IBS, which is very similar to a brick and mortar practice. It drives the high volume of care that's needed. We are starting to see a good proportion of complex IBD patients, and that's what Sam alluded to previously. These are, again, extremely complex patients. And when a community GI has that patient, they're trying their best to serve these patients, but we have to remember these patients have very high demands. They require a lot of time. The evidence on IBD is constantly changing. As busy gastroenterologists, we try to keep up, but sometimes there is a gap. And we had a patient who was following with their local GI, but kind of struggling. And he honestly initially came to us for RD and BH, and we started picking up some clinical acuity. And that's where the clinical team jumped in and we made some changes in management, but we collaborated with the local GI because this guy was like, either I'm going to go to an academic center, I'm going to go to ER, or I'm going to go to a different doctor. So some of these very complex patients are either doctor shopping or they're stuck in a place and they're just going to fall through the cracks and land up in an ER somewhere. So that's where we are collaborating very closely with the GI physicians, where they're still driving the main care, but we are supporting them because this patient is seeing someone at Oshi every 2 weeks. So we have the data points to give to the GI that, hey, maybe how about this? So it's very gentle redirection, but it's working as a team with the local GIs. So I think that's where the team has seen a lot of clinical growth.